Our aim is to try and find innovative solutions to real problems faced by NHS organisations.
Ultimately, what we're looking for is solutions which are based on the resources, the skills, the assets of local people and local communities.
My name's Jack Sharp. I'm a Director of Service Reform at Salford Royal NHS Foundation Trust, which is a local healthcare provider. And I'm working with the Integrated Care Programme in Salford and taking the lead on this pilot project. Salford has a population with quite significant health needs. It has quite a large elderly population, some 34,000 older people, and that population is projected to increase significantly over the next 15 or so years. Older people use a lot of health and social care services, and that demand is increasing. So we're seeking to find ways of supporting older people to take more control of their lives, to be more active. We also know when we talk to older people that they say retaining their independence and avoiding the need to use services where that's appropriate is really important to them. At the moment in Salford, far too many older people find themselves in hospital. They're admitted to hospital on an emergency basis via our accident and emergency department, and too many older people find themselves admitted to a care or to a nursing or residential home. So we're really keen to prevent that occurring. It's not the best outcomes for older people, and it's also the most expensive way of supporting older people. So we've been working over the last 12 months to develop a new approach to supporting older people. We've engaged 4 statutory organisations, the healthcare providers, the local government, local city council, and we've been working with older people and the third sector to develop a new model, a new approach. That model has three parts. The first part is how we support older people to retain their independence in the community, to access local groups, voluntary arrangements. The second part is how we support older people to navigate the health and social care system, creating some form of integration hub, because it can be quite difficult to find your way around the system. And the third part is how we bring health and social care professionals together to wrap around the needs of older people.
What we've been fortunate to do is to get some money from national level to resource this competition. So no money has been taken away from the local health and social care system in order to run this competition.
Help us find solutions which we can then take back to our NHS partners and implement in a way that we haven't done before. Social
isolation is a big problem and a big risk factor that can result in people needing to use health and social care services. We also know that the increasing demand in the health and social care system is such that we're not going to be able to continue to meet those needs in an effective way. We hope the competition will generate some new innovative approaches and ideas. One of the things we recognise is that we don't have all the solutions, that many of the good ideas that exist will exist in local communities. There may be ideas that are brought from other sectors, other industries, or ideas from other countries. So we have some quite good examples of supporting older people, self-care, local community groups, but they're all on a relatively small scale. And we know the nature of the problems that we're facing in the future, the size of the elderly population that's due to increase by 30% over the next 15 years means that we're going to need much bigger solutions. Salford's a great place. We've got organisations that have had a history of working together who are really kind of receptive to new approaches and to innovation. And we've got a kind of history of innovating, of trying out new ideas and approaches. What I want is a system that in 20, 30 years' time that I, my family, that future generations can look at and say, gosh, Salford is a really good place to retire because they've got it sorted.